the political debate begins with Question Time and David Dimbleby.
Tonight we're in Lancaster. Welcome to Question Time. Welcome to this special edition of Question Time, live from Lancaster. Tonight our focus is on education, following the damning report from Ofsted in September 2014, highlighting the falling standards in behaviour control in our schools. With the current issue of behaviour in the headlines, is ADHD the epidemic it is made out to be? Joining me on our panel tonight is Jack Toner, Government Representative within the Department of Education. We also have Mr Bill Jones, who is a head teacher at local school Moorside in Lancaster. And we also have Jessica Clements, who is a parent of a child who's been diagnosed with ADHD, as well as representing the campaign Living with ADHD. So let's get straight down to this now. So Ken Robinson, a widely respected education expert in both the UK and the US, has claimed ADHD is not an epidemic, but is in fact down to the way with school children rather than the children themselves. Mr Jones, can you start us off please?
I would definitely agree with that view in part, as ADHD is one of the most common special educational needs we have in our school, and that's the case in many schools, but I think that's probably due to the fact that children with ADHD tend to have such a large impact on the classroom as a whole and not just on themselves, so that can really encourage children to try and get a statement or a diagnosis early on. But the idea that ADHD is simply a result of poor or uninteresting teaching seems a bit ridiculous to me, and quite an extreme accusation for Ken Robinson to make. I think there would definitely be fewer diagnoses of ADHD in schools if each lesson could be catered to one child's needs. However, that's completely out of the question really, and education at the end of the day is about finding a best fit for as many children as possible given the size of classrooms. And the 2014 SEN Code of Practice itself even states that any action plan for children with special educational needs should take into account the pupils around them. So to say that it's just down to poor teaching seems a little bit extreme to me.
Can I just sort of question the meaning of best fit there? Can you sort of expand what you mean?
I think it's quite a controversial thing to say, and I'll probably take some criticism for it, but education has to suit 25, 30 children, not just one. Yeah. So you have to try and make it fit as many of them as possible.
Mr Toner?
I agree with what you're saying that ADHD, is not a myth, it is a real problem in schools. Mentioned the 2014 SEN Code of Practice, that's something that we've liaised really closely with the Department for Health to create an innovative SEN Code of Practice. And we've removed what was previously the School Action Plus categories. These were set up so for every diagnosis that you had, you would then get funding for that one particular child, whereas that's no longer the case. Abolishing this, we're trying to remove a lot of the negative impacts that come with labelling children, and now we no longer want children to be labelled with ADHD purely because of the money or the financial incentive that they carry.
I understand that you're trying to remove the need for people to label children to try and get money, and the financial incentive. But that money would go towards learning mentors to help the children with ADHD, particularly through one-on-one learning, to try and help them concentrate and not affect others around them. So I think that could be quite detrimental to the success of the children.
Let's just bring in Ms Clements here, who's a parent of a child with ADHD.
Mr Toner, this will have a negative effect on my child and all those children who do suffer from ADHD, as they are now seen as problematic to mainstream schools and carry no incentive. So as a result, head teachers are not accepting children with ADHD into their schools.
Well, yeah, I agree that in some cases children may not be admitted into schools because they're seen as problematic, but we are trying to tackle this. I haven't made myself clear about the funding available for these SEN children. Although we've removed this the School Action Plus, there's still a notional SEN budget which allows children to receive up to £6,000 in funding. And for the more severe cases of SEN, there's an additional top-up amount of this, which is provided through the local authority. With this more generalised approach, we're trying to remove the labelling of children having ADHD who may not, as we maybe mentioned before, about an overdiagnosis. We don't want children to be labelled if they don't truly have ADHD. So that's the reason why we've removed this. And there's still money there available as a whole school to put in your learning mentors on all these other things that would help.
Okay, let's get down to some actual statistics now. Bearing in mind that 400,000 children between the ages of 5 and 19 in this country are taking Ritalin on a daily basis to deal with ADHD. Is this really the best way to treat the problem? Let's start with you for this, Mr Toner.
Our ultimate aim as a department is to include as many children as possible into mainstream schools. We don't want to immediately send these children to special schools, because our ultimate aim is to be as inclusive as possible as a department. But through this, looking at some of the benefits that medication carries, we can't really ignore this as a solution.
Mr. Jones?
I think I completely agree with Mr. Tony. Medication isn't ideal, but you can't deny you can't deny the benefits it has on teaching and the success of the child, because medication such as Ritalin, which is the most common one, really helps a child's concentration and their engagement and the subsequent success they have in school.
Well, let me put this to you, Mr. Head Teacher. I've done some research before the show tonight, and I've found some rather startling statistics. Ritalin can have some serious side effects. These can range from mild headache to sleepiness to strokes and even possible sudden death in certain patients. This is a psychostimulant drug that shares properties to cocaine, and yet it's licensed in the UK to children from the age of 6. Surely there's better options. I mean, I've found something called neurofeedback brain training, which is a far more safe and effective alternative from drugs. There's no surgery, no medication and no side effects. Would alternatives such as this not be a better alternative to medication?
I mean, I'm not going to claim to be an expert on the drugs and the medication, the medical side of this, but I think you're absolutely right. We should definitely be looking at more natural, holistic techniques to help the child that might have fewer side effects. But an NHS in 2013 stated that a doctor's definition of ADHD and how to diagnose it has broadened in recent years, which has led to that, that more children being more frequently prescribed drugs. In the UK, this report estimated that the drugs for these sort of disorders can cost the government up to £200 million a year, which is a huge amount of money, which could be spent exploring these alternatives that such as the neurofeedback brain training that you just discussed then. This report also sort of discussed, as I mentioned, the labelling issue that we've talked about at the start of the show, which these matters are far beyond my control and my understanding in a lot of cases, but the government definitely needs to do something to address this problem.
What you have to
well, as I can say to that, as a department, it's kind of beyond me. We don't deal with all the health and all the categories that they used to categorise ADHD. I'm not really qualified to comment on that, really. It's part of my role in the government, and I would simply reinforce we are looking to support these cases of ADHD and all children in primary schools. So we want them to be able to access their education.
Mrs. Clements?
But we shouldn't be drugging our children to make them fit in with the education system. We should take advantage of this and the energy and the inquisitive nature whilst teaching them. The Forest Schools Association have acknowledged that children diagnosed with ADHD and the symptoms it carries are not problematic in this forest school setting. Would the government not be better off using this money spent on the drugs and medical intervention to adopt some of the forest school strategies to use within the primary school?
To Tony.
Well, I agree really, and I recognise a lot of the great work that Forest Schools does. Note 2011 suggests that Forest Schools develops a range of social, emotional and behavioural aspects of a child that's otherwise not developed in a mainstream education setting. However, this type of education is limited when you've got to focus on your maths, English and science. It's not necessarily the best way to approach it. So I wouldn't really suggest an overemphasis on them kind of techniques.
Ms. Clements?
The New Forest Parenting Programme has been developed to help parents with children of ADHD. It's a parent-led intervention guiding parents to help their child with ADHD. It's a great scheme and it allows it to be tailored to the individual children. This provides extra support for families who struggle with the diagnosis of ADHD. Surely schemes like this are the way forward and we shouldn't immediately consider medication.
Yeah, we completely agree. We do offer other schemes such as Sure Start. Sure Start's put in place to support those children before they suffer when starting school. It's designed to prevent future problems, and by no means is medication the first port of call. I mean, a lot of the time, and I'm not saying this for every case, but parents are the driving force in wanting medication for their children, and it's only those who can prescribe it. It's not the head teacher, it's not teachers in schools. They have no power in the say of medication. But we are looking to implement some of these other types of approaches, such as Sure Start and the scheme that you've just mentioned there, Jess.
Let's have a look at it from one more angle. Recent statistics show that the highest majority of diagnoses occur when a child is 5 years old, which coincidentally is the first year in education. Surely there's something in that. Ms. Clements?
Does this not demonstrate that it's the school's failure to accommodate a large proportion of the young population. Although I believe most cases of ADHD are correctly diagnosed, I do not believe that the schools are inclusive enough with children with behavioural and social problems.
I would definitely state that it's not a coincidence. Obviously, you know, as soon as children come into school, teachers start trying to label them to almost make their job easier. But I think it's really difficult as a school and as a teacher because you're under constant pressure from Ofsted to provide results, and if a child isn't meeting the levels that Ofsted want them to, you have to give a reason why. And in a lot of cases, you know, if a child's incredibly hyperactive and struggles to concentrate, ADHD provides a good explanation of why they're not meeting those levels. You know, whilst I hope none of my teachers use this medical diagnosis as a scapegoat, it is the reality of a target-driven environment that Ofsted have put on top of us that, you know, we need to constantly try and meet.
Mr. Tony?
Well, yeah, education is about what's important to us. We're in charge of making sure every teacher is as effective as possible. And Ofsted, it's no part of us. It's it's a completely separate body, but they are there to help and support teachers as well as regulate the standards. If a child, the first port of call, if a child is struggling, would be to look at the teacher, and if they've been regarded as outstanding by Ofsted, that's one kind of tick in the box, if you might say. So they're there to help and support the teachers sometimes in a lot of the decision making, as well as to regulate the standards as we do.
As always, we must stop too soon. Mrs. Brown's Boys are on BBC One next. Next week, we will be in Tower Hamlets to discuss the startling words from Russell Brand regarding new poverty levels in London. Thanks to my panel of guests in Lancaster tonight. There is now a live forum on BBC Radio 5 to discuss the topic of ADHD further. Thank you, good night.